ఆరాధన టీవీ ప్రేక్షకులకు నమస్కారం. వెల్కమ్ టు ఆరోగ్యమే మహాభాగ్యం. ఈ మధ్య కాలంలో మనం మలేరియా, డెంగ్యూ ఫీవర్ మరియు స్వైన్ ఫ్లూ గురించి చాలా వింటున్నాం. మరి ఈ వ్యాధుల గురించి ప్రజల్లో ఎన్నో అపోహలు ఉన్నాయి. మరి భయభ్రాంతులకు గురవుతున్నారు. ఈ వ్యాధులను మనం ఎలా నివారించాలని ఈరోజు తెలుసుకుందాం. మన మధ్యలో డాక్టర్ ఆశీష్ చౌహాన్ గారు ఉన్నారు. వారు MBBS CMC వెల్లోర్ నుంచి చేశారు. మరి ప్రెజెంట్లీ కన్సల్టెంట్ ఫిజిషియన్గా యశోద హాస్పిటల్లో తన సేవలను అందిస్తున్నారు. డాక్టర్ గారు, వెల్కమ్ టు ఆరాధన స్టూడియోస్.
నమస్కారం.
డాక్టర్ గారు, this being a season of fever, cough and cold, and the most annoying symptom is fever, we would like to know, how do we get fever?
Lot of patients I get in hospital who come with this symptom of fever, and I know it turns out to be a very annoying symptom. But most important thing which I convey to all of my viewers and audience is fever is a defense mechanism of the body. So it is very good for patient to have a fever, because that way it reflects your body is fighting back perfectly fine. So in a way it's good to have a fever. But yes, it annoys a lot, it troubles a lot, so we need to tackle it accordingly.
Okay, Dr. Garu, మరి fever రావడానికి కారణాలు ఏంటి? What are the causes of fever?
There are many causes. If we go through the list, there will be more than thousands. But in current season, I would like to say the common flu, dengue fever, swine flu or malaria are the ones. But out of all these, I believe swine flu is the least common of the given some ones I've told you.
Doctor, what do we do when we get fever for one day?
Lot of my patients come with fever of one day and they get very scary about it. First thing which I would want to tell all of my friends, that they need not to worry about it. The most important thing they need to do is calm down. And the most important thing which helps the body to recover is only giving time for body to recover. Giving adequate rest to the body and taking paracetamol tablet as and when required, as well as on the advice of your medical practitioner, turns out to be best medication which will help you out in recovering from the fever.
చాలా బాగా చెప్పారు డాక్టర్ గారు. మరి ఈ మధ్యలో మనం వైరల్ ఫీవర్ గురించి కూడా చాలా వింటున్నాం. Would you like to elaborate a little more on viral fever?
Viral fever is primarily attack by the virus to our body, and it presents by the symptomatology as per it involves the organ. First time respiratory system involved aithe you get దగ్గు, గొంతు నొప్పి, తలనొప్పి, and lot of జలుబు. So it starts from their side, and then depends on that if it involves the GI symptoms, vanti, కడుపు నొప్పి, loose stools, all these things come, and finally you will have a lot of fever as well as high grade fever and body pains.
మరి ఈ ఫీవర్ కి మీరు ఎలాంటి ట్రీట్మెంట్ ఇస్తారు డాక్టర్ గారు?
Viral fever, the best way to treat as given and told by my seniors is, if you take treatment it improves in 7 days. If you don't take treatment it recovers in 1 week. The most important thing about viral fever is to take adequate rest as well as give time for body to recover. But in the present scene, when we have a lot of patients with dengue and swine flu, I would want to advise you, whenever you have a fever, you must contact your medical practitioner as soon as possible.
డాక్టర్ గారు, మరి ఈ మధ్యలో స్వైన్ ఫ్లూ గురించి వింటున్నాం కదా. వాట్ ఆర్ యువర్ కామన్ స్వైన్ ఫ్లూ?
Swine flu as such, if we see the patients, we have very less. But yes, I know there are a lot of people and there are a lot of scare about this thing in our general crowd. I would want to say patients do present with normal complaints again of talanoppi, దగ్గు, ఎప్పుడన్నా they get ayasam. And the most important thing which we need to do is, when in doubt, contact our government hospital or contact your medical practitioner. That turns out to be best deal. Delaying in diagnosing can be something which will be harmful for you as well as for your life.
మరి స్వైన్ ఫ్లూలో ఉన్న లక్షణాలు అంటే symptoms, what are the symptoms you would like to tell our audience?
The most important thing in a swine flu is, importantly it involves your respiratory symptoms. So importantly idilo దగ్గు, గొంతు నొప్పి, ఆయాసం ముఖ్యంగా వస్తుంది. ఎప్పుడు అన్నా you will get a high grade fever, and most importantly it will involve only the respiratory system. Your other symptoms like GI or kidneys will not be affected primarily by it, unless until you come and you wait for it to affect your full body, and you will end up in multi-organ failure.
డాక్టర్ గారు, స్వైన్ ఫ్లూ గురించి చాలా ముఖ్యమైన విషయాలు చెప్పారు. మరి డెంగ్యూ ఫీవర్, what are the symptoms you can see in patients with dengue fever?
Dengue primarily presents with high grade fever and headache. If I have to say as a triad form, it comes with fever, headache and erythematous rashes where you have got red spots all over your body. It primarily presents with two forms. One is where the platelets decrease, which is a big problem, and second thing is when patient goes into septic shock form where the BP goes down. And we need to be proactive in handling both the situations. As and when you have a body where you've got fever, headache and erythematous rash, ఇది ఫుల్ రెడ్ దుద్దల్లాగా వస్తున్నాయి, ఆ టైంకి యూ హ్యావ్ టు కాంటాక్ట్ డాక్టర్స్.
డాక్టర్ గారు, మరి డెంగ్యూ ఫీవర్ని ప్రివెంట్ చేయగలమా? కెన్ వి ప్రివెంట్ డెంగ్యూ ఫీవర్?
Very much. It primarily is spread by mosquitoes.
Okay.
So if you in any way you can decrease this mosquito bite, that is what you can prevent in dengue. One most important thing to know about dengue is these mosquitoes primarily bite you either in the early morning or in the early evening. It's not in the night times which we need to be bothered about. So if you can protect your body from mosquito bites between say morning 5 to 8 as well as evening 5 to 8, then that means you've already saved yourself from 90% of bites which can cause you dengue.
చాలా బాగా చెప్పారు డాక్టర్ గారు. మరి ఫీవర్ వచ్చే ఇతర కారణాలు ఏమన్నా? ఆర్ దేర్ ఎనీ అదర్ కాజెస్ ఆఫ్ గెటింగ్ ఫీవర్?
Yes, as per the existing time, though as I've already conveyed to you, is common flu, dengue, malaria, the three main reasons, and very least of them being the swine flu. We have the other causes which is a big list which involves the other reasons like tuberculosis. It can cause even autoimmune disease as well as the other system involvement. If you have got acute gastroenteritis, urinary tract infections, there are all these things will present to you with fever.
డాక్టర్ గారు, మరి ఫీవర్ 14 to 15 days వరకు కంటిన్యూగా ఉంటే దానికి ఎలాంటి ట్రీట్మెంట్ మీరు ఇస్తారు?
If you have a fever which has been standing for a long time, 14 to 15 days or a month, or which is getting recurred, once it is getting resolved for 4-5 days and again coming back, that means you really need to take it seriously. You really need to look into it. What problem are you facing? It can be typhoid or hepatitis, or it can be something more grievous and more damaging which we need to look into it. I think that's a time that you need to switch over to tertiary care centers where you can come over to say Nizams or Osmania or to the corporate setup.
Okay, చాలా బాగా చెప్పారు డాక్టర్ గారు. After the brief description of fever, we would like to know more about dengue fever. What are the causes of dengue fever?
Dengue fever is a viral fever and a primary virus which has 4 types, type 1, 2, 3 and 4, which causes dengue fever. Which what most important thing which we need to know that it is spread by Aedes aegypti mosquito. And if we can control, the reason to know this is if we can control this vector, that mosquito, then we'll be able to prevent this dengue disease as such. And once we come to the point of the presentation of dengue, it primarily comes to our body, as I've already mentioned, in 2 forms. It comes either in the form of where it causes a fever, headache and thrombocytopenia with erythematous rashes. These rashes are a red color spots which you get all over the body. In patients of this triad where the platelets decrease, patients can have various manifestations where the platelets are low.
మరి డాక్టర్ గారు, డెంగ్యూ ఫీవర్ కి లక్షణాలు ఏంటి? What are the symptoms that you can see in a dengue fever patient?
As I have mentioned, the dengue causes the platelets to be decreased in our body. The platelets are type of one cells in our blood, and once they decreased, patients can come in very many forms. The most important function of these platelets in our body is to make sure that the hemostasis in the blood vessel is maintained. So if whenever they are decreased, the most common symptom patient presents with is a bleeding from the normal sites. Patient can come to us where he has got a దగ్గులో రక్తం వస్తుంది, ఇప్పుడు వాంతిలో రక్తం వస్తుంది, or loose stools mixed with blood. And in one of the unusual but a very common presentation is where the patients and the ladies hesitate to speak it out is untimely menstrual periods restarts. So if a patient is there who comes with fever, with the erythematous rashes, and she says or she is hesitant to say it out, we need to ask whether the patient has got untimely menstrual periods. These are the different ways the bleeding manifestations of dengue which it can come in any patient.
డాక్టర్ గారు, మరి డెంగ్యూ ఫీవర్ కనుక్కోవడానికి పర్టికులర్ బ్లడ్ టెస్ట్ ఏమైనా ఉన్నాయా? హౌ డు యూ డయాగ్నోస్ డెంగ్యూ ఫీవర్?
Besides the clinical diagnosis which all of the doctors make it, we need to look out for this special kanalu I have already told you is about platelets. So platelets and the TLC count primarily goes down in the body. So patient can have a bicytopenia, adelo శ్వేత రక్త కణాలు తగ్గిపోతుంది, platelets తగ్గిపోతుంది. Besides this, it can affect liver lo vastundi, so you can have a SGOT, SGPT which can be raised. But besides, other than these two things, it affects the whole body. There is some syndrome called as serositis, where patients ki pleuritis, pneumonitis as well as ascites features bada vastundi, which normal MBBS doctors usually pick it up.
Once you have diagnosed the patient as dengue fever, what is the kind of treatment you would like to give to the patient?
The dengue primarily is treated as a symptomatic treatment, which is important. I would want to tell most of my friends that there is no definite treatment for dengue. It's a symptomatic treatment which really helps out. Patient presents to us with fever as well as headache. So paracetamol tablet helps out in controlling his fever as well as headache. Antibiotic per se do not have any direct role in controlling dengue fever. But in order to save a patient get a secondary infection, we give antibiotics. The chances of having GI bleed is very high. That's why we give pantoprazole or the other gut antacids which will help out. So besides paracetamol, giving antacids as well as things to reduce the acid secretion is the best thing. And again, I would like to reiterate, there are two ways which dengue presents with, where the platelets has decreased as well as BP and pulse decreases. So we need to rehydrate patient with lots of fluid as well as in terms of IV fluids and oral intake of water.
చాలా బాగా చెప్పారు డాక్టర్ గారు. మరి ట్రీట్మెంట్ గురించి చెప్పారు కదా, మరి హౌ డు యూ ప్రివెంట్ dengue fever? Are there any precautions the patient needs to take?
The best way, as we have conveyed, that the dengue is spread is by this mosquito bite. And if we will be able to prevent mosquito bite to our body as well as in our family, we will be able to prevent us from dengue. The most important time, already reiterated, that it's from bites in morning 5 to 8. So you have to cover your body completely. For men and as well as other people, I'll advise them to wear full sleeve shirt and not to roam around in half shorts. Try to cover your legs, not to expose most part of the body. Besides this, the mosquito, they breed in the stagnant water. Try not to have any local collection of water, like we have water stagnant in the cooler which are not being used. There could be water around in the tubes, the tire tubes which are lying around. We would make sure that there is no stagnant water in around surroundings. Outside, we all are bothered about the hygiene within the house. We usually do not, we overlook the hygiene outside our house. See the holes, the main holes as well as all the sanitary garbage bins. So those things we need to make sure that there is no storage of stagnant water. If we can make sure that our surroundings are clean, I don't think we will need to worry about dengue.
ఫీవర్ గురించి మరిన్ని విషయాలు తెలుసుకునే ముందు ఒక చిన్న బ్రేక్ తీసుకుందాం.
ఆరాధన టీవీ ప్రేక్షకులైన మీ అందరికీ ఒక గొప్ప సువర్ణ అవకాశం. వేదాంత విద్యను అభ్యసించి దేవుని సువార్తను ప్రకటించాలని ఆసక్తి కలిగి ఉన్నారా? అయితే మీరు మీ ఇంట్లోనే ఉండి ప్రతిరోజు ఆరాధన టీవీలో ప్రసారమయ్యే బైబిల్ క్లాసెస్ ను వీక్షిస్తూ కేవలం 1 సంవత్సరంలోనే వేదాంత విద్యలో డిగ్రీ పూర్తి చేసి బ్యాచిలర్ ఆఫ్ క్రిస్టియన్ మినిస్ట్రీ సర్టిఫికేట్ ను పొందగలరు. అయితే ఆలస్యం దేనికి? అడ్మిషన్లు ప్రారంభమైనవి.
వెల్కమ్ బ్యాక్ ఆఫ్టర్ ద బ్రేక్. డాక్టర్ గారు చాలా బాగా చెప్పారు డాక్టర్ గారు. మరి మలేరియా కూడా మనము ఈ మధ్యలో చాలా తరచుగా వింటున్నాం కదా, మలేరియా ఎలా వస్తుంది?
In the given scene we have a malaria and dengue coming hand by hand, because This again is caused by mosquitoes. I would want to tell you that malaria as such is called by the main parasite, which is Plasmodium. Out of 4 entities which we know in scientifically, the 2 which are very much common in our given area is Plasmodium vivax and Plasmodium falciparum. And these Plasmodium, once transmitted by Anopheles mosquito, patient gets a malaria. So again, coming to the point, how does it present? Patient comes with a high grade fever. It comes with a lot of aches and pains all over the body, and it can involve, slowly it involves the full body. It spreads through the bite of when the patient is bitten by the mosquito. With that bite, the Plasmodium goes in the blood cells. Once the blood cell is circulating all over the body, patients get high grade fever with chills and rigors. And that's why, as most of our friends already know, the patient presents with fever and chills and rigors.
Doctor, how do you investigate, how do you diagnose malaria?
Any high grade fever with chills and rigors, we need to consider malaria.
Okay.
But liver involved, or if it involves the kidneys, where it can cause black water fever, and if it is causing lungs, where it can cause pulmonary edema, and if patient comes with a multi-organ dysfunction syndrome with high grade fever, we do kind of consider in our mind the patient can have a malaria. Sometimes in the rare scenes, it involves the brain, where patient can have developed cerebral malaria, and that can be very dangerous as well as fatal for the patient. So whenever we have a fever, which is high grade fever, along with your involvement of liver or kidneys, which can be notified by having decreased urine output, or even alteration in the urine color. It's otherwise also known as sometimes black water fever, because you'll have urine which will come out as black water types. That time you must notify and contact your medical professional as soon as possible.
Apart from all these symptoms, is there any other blood tests that detect malaria?
Malaria detection is done by 2 main reasons. We can do the thick and thin smear, which is available at all the PHCs as well as all the government centers. And besides this, another test is one antigen test which is possible, which is again reasonably available now, which detects much earlier if we do it on the right time. So these 2 tests, smear testing as well as antigen testing, can help us out. I would want you to add to this is the most important thing is a clinical suspicion. We've had patients where patients have come from the endemic zone, which is full of malaria patient, but smear as well as the antigen which I've talked about can be negative.
Okay.
And at that time, only because of our clinical experience, we have given the patient anti-malarians, and patient has shown remarkable improvement because of that. So having a good doctor who can kind of keep having high suspicious regarding that malaria, because patient coming from that zone, is what is most important.
Okay. What is the kind of treatment you give to malaria patients?
The main treatment for a vivax malaria, which is the common one, turns out to be chloroquine, which I would want to tell all of my friends is very cheap and very widely available. And it can be easily, it's all around 5 to 10 rupees, and it is available in any nearby medical center to you. But I would want to tell you again that there are a lot of vivax resistant patients which are again coming up, as well as falciparum which is present, which is a slightly deadlier kind of malaria. And in such cases, we need to give higher therapy, which primarily involves artesunate and other combined therapies.
డాక్టర్ గారు చాలా బాగా చెప్పారు. మరి స్వైన్ ఫ్లూ గురించి మాకు డీటెయిల్గా చెప్పండి. స్వైన్ ఫ్లూ ఎలా వస్తుంది? హౌ ఇస్ స్వైన్ ఫ్లూ కాజ్డ్?
Swine flu is again a viral disease which we already known as a common flu, and it is spread by H1N1 virus, which has started as a pandemic from last 1 year, and it's been going from all different countries. It primarily spreads through the aerodigestic tract, where you respiratory tract, when you talk and when patient is having a cough, through the cough you can transmit to the other person. That's why what we need to be cautious about it. We need to improve our normal habitats and etiquettes. Is whenever any one of us have got cough, we must, if we're about to cover our face, as well as to make sure that we do not cough on any person if we have got fever, or even if without fever, we must learn to cover our face with a handkerchief or dasti and make sure that we do not cough it out. In that way, we will be able to prevent spreading swine flu. But besides this, I would want to tell you is we need to make sure that we are not scared of swine flu. As per the statistics, the mortality rate of swine flu is much lower as compared to dengue and malaria. Ask me honestly, I am more scared of dengue and malaria than to swine flu. For swine flu, there is a definite medication as for malaria as compared to dengue, where we do not have a specific medication. So what we need to do is, as and when you doubt, you come to reach your medical professional, get yourself checked by for the swine flu. And that also available is very easy. You need to get a throat swab as well as nasal swab done, and report almost comes within 24 hours, confirming it whether it's present or not. For all my friends in periphery who are the medical professional, swine flu treatment has been advised even to be started if your suspicion of doubt is very high. If we know that the patient has got exposure to the swine flu patient, or patient has been to the country where the chances of swine flu is high, a drug which is very simply available now is oseltamivir, which is available, which can be easily had in our pharmacy in nearby places by the name of Fluvier and Tamiflu. It is available, which can be given 75 milligrams twice a day or for 5 days, which is really giving us a lot of promising results. Besides treatment of swine flu, now the swine flu prevention is also available, where we can vaccinate each one of us. Recently, couple of days back, our central minister has been shown to be taking the swine flu vaccine. It is available in two forms, where there is an injection which can be given intramuscularly, or besides that we can give an intranasal spray vaccine, which is widely available. The injection which is available is a multi-dose, but 0.5 ml dose has to be given subcutaneously or primarily IM, which will help us out in developing the immunity against the disease within 10 to 12 days.
డాక్టర్ గారు, మరి ఈ మధ్యలో తరచుగా చూస్తున్నాం కదా, చాలా మంది మాస్క్ కట్టుకుంటున్నారు. How far it is important to wear a mask?
So you've asked me a very tough question, because when we say that swine flu is spread through our aerosols as well as droplets, the locally easily available masks actually do not prevent complete transmission of swine flu. There are special masks which we call N95 masks, which are very costly, but I wouldn't advise you to run for those masks. What we need to learn is make sure that we do not cough directly on the face, as well as to cover ourselves, which will give adequate prevention of spreading this swine flu. In the case of swine flu, the isolation for a period of 4 to 5 days serves a much better purpose rather than anything else. So if any patient is suspected to be having a swine flu, or has been found to have a swine flu, in isolation along with treatment with oseltamivir helps him out as well as saves his family in getting the swine flu.
Okay. Dr. Garu, I have a question. Children suffering with symptoms of swine flu, can they attend school or can they go into crowded places?
No. The swine flu, as I've told you, it's spread through the aerosol infection, where you cough or where you speak. Even the droplets can transmit the disease. The most important thing for a swine flu is isolation. So I would surely not advise, or rather I would like to give the idea, if anybody who's got a fever should stay away from any crowded place and rather prefer to stay at home, which is much better rather than spreading the infection. In order to perpetuate the same idea, of late we have been having a lot of advertisement where people have been shown covering their face when they are coughing, as well as staying in isolation and watching others to enjoy or to play. The time 4 to 5 days of isolation not only helps in containing the infection, it makes sure that we will be able to eradicate this infection, even only if we prevent it well.
Doctor, what is the advice you would like to give to healthcare professionals regarding swine flu?
The most important thing which all of us need to know is we need not to panic about any disease. I would want to make a special note of it. All these diseases are coming because of our wrong habits. I would want to convey is once we do not do the good hygiene around our places, there are a lot of mosquitoes, and you get dengue and malaria. when we forget and we kind of don't remember to wash our hands, we do not try to cover our face while we are coughing or while speaking, there is a lot of infection. So if only we maintain our personal hygiene, if we maintain proper sanitation, we need to be making sure, as to remember the old dictum, that cleanliness is next to godliness. And if we can remember that dictum, we will be able to save ourselves from most of the existing diseases.
In conclusion, what are the do's and don'ts that you would like to suggest to the patients regarding fever?
In the given season, if you have a fever, I have few do's, and especially is you make sure you take adequate rest. You make sure you alter your diet in terms of not going with the normal diet of pachadi, karam. You must alter to soft diet. You must take much and much more of, whenever you are in doubt, to contact medical professional, whosoever is near to you. If there is, besides this, the main don'ts is make sure you don't panic. Whether it's dengue, it's malaria, or it's flu, even if it is swine flu, almost everything is reasonably can be controlled by adequate attention. You must avoid the spicy food. You must avoid work. The fever as well as having infection is God's way of telling you that you need rest. Giving rest to your own body gives body its good capacity to fight back and make sure that your infection is controlled. The final word which I would want to leave with all my audience is prevention is much more better than cure. I must tell you that I have a lot of patients coming to me with lot of doubts, lot of anxiety in their heart, and asking me 100 questions, asking me guarantee whether my patient will survive or not. I would want to reiterate and tell all my audience is we are humans. We never want any patient of ours to die or and become serious. The first and the final word to remember is we treat, he cures. You have to have a faith, an immense faith, and you have to remember that we are only mediators. It's finally God who decides everything for us. Have faith in God and make sure that you trust Him completely, much more than doctors or science, because yes, still in present day's words, miracle do happen.
Dr. Garu, thank you for sparing your valuable time. నమస్కారం. చూశారు కదా, ఈరోజు ఫీవర్ గురించి మనం ఎన్ని ముఖ్యమైన విషయాలు తెలుసుకున్నాము. మరి ఫీవర్ని ఎలా నివారించాలి, దాని యొక్క ట్రీట్మెంట్ మనం ఈరోజు తెలుసుకున్నాం. మరి వచ్చే వారం ఒక కొత్త టాపిక్తో మీ ముందు ఉంటాం. అంటిల్ దెన్ కీప్ వాచింగ్ ఆరాధన టీవీ.